Hospitals around the state are trying to figure out how to manage without hundreds of millions of dollars in state funding, money that is not in the new state budget that went into effect last month.
We're already hearing about hospitals having to eliminate positions, stop hiring, cut services. Shelton State Representative Jason Perillo says he saw this coming as lawmakers battled over the state budget among themselves and with the governor's office. Thank you for coming in.
Thank you for having me. Good to see you again.
$550 million, that is a lot for these hospitals to absorb, and they can't count on it now. And how are they going to make it up? And how did the people who favored this idea, this kind of cut, justify it?
Well, $550 million isn't just a small cut. This is deep to the bone.
Yeah.
You're seeing Danbury Hospital and New Milford Hospital just announced 116 job eliminations. St. Vincent's Hospital down in Bridgeport, 100 jobs. Waterbury Hospital not too long ago, 83 jobs.
Day Kimball up in Putnam,
Day
too?
Kimball, absolutely.
Yeah.
And I don't think we're done. When I'm talking to CEOs, they're worried. They're nervous. They don't know what to do. And it's not just the administrators that are concerned. It's the frontline nurses and clinical workers that are already struggling to handle their patients and treat their patients and give them the time and attention they need. Now we're faced with the possibility of more cuts and more layoffs. How do you make that work? Something has to give.
Well, the governor has suggested that perhaps one thing that could give is the salaries of the top execs at hospitals.
Anybody who thinks that cutting executive salaries at hospitals is going to solve the problem and ensure that patients have the care they need, with all due respect to the governor and his staff, that's pie in the sky. That's imagination.
It's just not enough.
It's not enough. It's
well,
not.
Let's talk about that, because I think a lot of people are sitting there at home saying, well, why do they have to make $1 million or $2 million or whatever and get all of these perks and everything? I mean, a lot of executives in high-powered positions are making half that and even less. And they're doing fine. So why do hospitals have to have people that highly compensated?
I mean, I'd love to be making that kind of money. There's no doubt about it. That would be great. But at the end of the day, let's understand what these men and women are doing. We're not flipping burgers here. These are very large hospital systems. They're treating thousands and thousands of patients a year. They're making what they're making. But at the end of the day, as I said before, blaming hospital CEOs for this it's pie in the sky.
So if we had to put that 550 back into the budget, put it back in there so the hospitals were not touched, then what? Where do we make up? Or are we going to have higher taxes? Are we going to cut spending somewhere else? And if so, where?
Well, there's actually a lot of things that we could have done and a lot of things that we had proposed as House Republicans and Senate Republicans. One thing that people don't realize is all the waste and fraud and abuse that exists throughout our social services, be it Medicaid fraud, unemployment fraud, you name it. There's quite a bit of money there. And we had proposed a program that would have really helped us capture some of that money.
Tell me about that.
Capture some of that revenue. We've actually proposed this for a couple of years now. There are both technology systems in place and staff that can do this. It's been done in other states. And there are hundreds of millions of dollars right there that can be saved. The governor's budget has proposed some of that, but adds no staff and to do it. It can't be done without actually investing some dollars into that. You invest a little bit of money, and it goes a long way, and make sure that folks really aren't utilizing the system inappropriately and aren't getting taxpayer dollars that they shouldn't be getting.
Are the hospitals actually getting less money than they got in prior years, or they're just not getting the increase that they've seen in previous years?
They're getting less money than they've seen in previous years.
Has it been going steadily down? Have they been steadily cut?
There was a cut that was made in 2012,
yeah.
And then there was another cut that was made
in the increase, or an actual cut to what they got?
An actual cut to what they're getting. Hospitals are giving money back. And quite frankly, in the middle of their fiscal year, in the middle of their budget year, they're sitting here holding the bag saying, what do I do now? I had counted on this money, and now I'm not going to get it. What do I do?
So one of the things that they're doing, as Al said, they're already announcing layoffs. I mean, obviously, they try to make the cuts where it's not going to be directly affecting patient care. How confident are you that a majority of those cuts will not have an impact on the patient?
Hospitals are really working hard to make sure that those cuts are behind the scenes. They're not on the front lines of patient care. But in some areas, we're simply going to see that. What a lot of hospital CEOs have been telling me is, they cut those areas that aren't necessarily at the bedside. They cut community programs like infant mortality, which is being cut up in Hartford. Other programs we're hearing about are mental health programs, which is obviously a key issue here in Connecticut right now.
Sure.
Those community outreach programs are oftentimes the first things to go. What is it that a hospital does that isn't essential? Everything they do is essential.
Well, everybody at home, I'm sure, is thinking about this and saying, well, what am I going to see? Am I going to have to wait longer for a procedure I want to have done? Are the emergency room waits going to be longer? How are these cuts actually impacting people who come to the hospital for their services?
Well, it comes down to two things. It comes down to, first, access. As you said, you have to wait longer to get an appointment. You have to wait longer for your procedure to be done. Then it comes down to patient safety, too. The fewer clinicians who are taking care of a patient, the higher the risk that something goes wrong. So those are two things. If you're somebody who works at a hospital, if you're somebody whose spouse works at a hospital, if you're somebody who utilizes the services of a hospital, you need to be really angry about this. You need to be really angry.
I wanted to, we did receive a letter from the Western New England Hospital Association, and I wanted to bring that up if we could. This is John Murphy from the Western Connecticut Health Network saying, despite our efforts, the complexities of healthcare and how it is financed were reduced to a simple line item on a spreadsheet and the budget passed. He went on to say, as a result of these taxes and reimbursement reductions, we've been forced to make difficult and unpleasant decisions. He was making reference there to the battle that they tried to put up as the budget was created, and they ultimately failed. And now he's, as you said, trying to figure out how to manage it without having a big harm on patients.
Hospitals were very, very clear from the start during this budget process. If you make these cuts, if you cut $550 million, we're going to see a loss of jobs. They were very honest and upfront about that. Now, maybe the governor thought he was going to call their bluff. I don't know. But what they said has come true. And we're seeing hundreds of jobs lost so far. And we're not done.
All right, so what do we do about this now as a legislator? We wait till the next session and then look at this again about putting money back? Or is there some emergency session that you're proposing? Or how are we going to go forward with this? We got Obamacare, kind of gearing up and taking effect, and I'm wondering, I'm thinking that's going to have another impact.
Well, and one of the arguments that I've heard from the governor's office is that once Obamacare goes into effect, the hospitals will be made whole. They'll generate more money. Once
that's
that
not
happens.
True?
And that's not true. That is just a falsity. Every study that I've seen says that hospitals at the end of the day are actually going to lose out after Obamacare is introduced. And the reason is that much of the revenue that hospitals make, because they lose money on Medicare and Medicaid, they actually lose money. It costs them more to treat patients who are Medicare and Medicaid patients than they actually get in reimbursement. The only way that works is because there are private insurers who pay more. So it becomes a cost shift and it makes it work. The more folks who get away from commercial insurance and who are switched to government programs, there's no one else to shift that cost to. So that argument that Obamacare is going to help hospitals simply doesn't hold water.
All right. Well, Jason, thank you. Jason Perillo from R-Shelton.
Thanks.
Thank you very much give our regards to the Valley.
Absolutely.
All the people, great people. And thanks for being on The Real Story.
Thank you both very much.